This is report on a 12-year-old female that came in for a head-to-toe assessment. She was alert and oriented ×3, good nutritional status. She had access to 3 meals a day. BMI was appropriate according to height and weight. Good mobility and gait upon walking in. No deformities or abnormalities were noted or reported. She had good posture, which was upright and straight. She was in a good mood, and she stated that she was happy. Her natural language was noted to be English, and she was noted to be nice and clean. I started with the skin. Her hair distribution and color was appropriate according to race. She was warm and dry to the touch. Hands and nail beds were noted to be nice and clean. Capillary refill was less than 2 seconds. Peripheral pulses were palpated, both radial and brachial. I moved to her head. Her scalp was noted to be nice and clean without infestation, redness, or irritation. Her hair was noted to be blonde and clean. No tenderness to palpation of the head. I moved to her face, which was noted to be symmetrical. Cranial nerves numbers 1 through 12 were intact. Her temporal artery was palpated without thrills. Denies any tenderness to the maxillary or frontal sinuses. Assessed the neck and was negative for pulsations. No lumps, bumps, or bruises were noted. No thrills to palpation of the neck or trachea. All lymph nodes were palpated without tenderness or swelling. Inspected the carotid arteries one at a time. No thrills to palpation were noted. I auscultated bilateral sides without murmurs or thrills. Assessed cranial nerve number 11 and noted to be intact. Good range of motion and muscle strength were noted in the neck. I moved to the eyes. The external structures were clear without irritation. The eyebrows, eyelids, and the eyelashes. Her conjunctiva was noted to be nice and pink. Pupillary reaction was equal and reactive to light and accommodation. Sclera was white, iris was blue, and the corneas were assessed from the side and noted to be round and non-concaved. I moved to the external ears, which were noted without drainage or irritation. No tenderness to palpation. The nose was noted to be midline, good bilateral patency, and mucosa was pink and septum was midline. I moved to the lips, which were noted to have no cracks or irritation, no lesions. Mucosa, teeth, gums, tongue, hard and soft palate, and the tonsils were moist and without exudate. The thyroid was palpated without tenderness, excuse me, and no enlargements were noted. I moved to the lungs. Posterior inspection with AP to T diameter. Scapula and spine were midline. Anterior inspection were without the use of accessory muscles. Respirations were even and unlabored and noted to be right at 16. Lungs were clear to auscultation times all lobes. I checked for CVA tenderness during posterior inspection and denies any tenderness to palpation. Her heart sounds were auscultated while sitting and lying, and no thrills or murmurs were noted. S1 and S2 were noted. Heart rate with regular rate and rhythm. An apical pulse was palpated at the 5th intercostal space left side at mitral valve. The abdomen was inspected at eye level with good contour, nice and flat. Color was appropriate for race. No scars or striae were noted. It was symmetrical with no peristalsis or pulsations noted, and the umbilicus was noted at midline. Bowel sounds were present times all 4 quadrants, tympany to percussion to all 4 lobes, and negative to light and deep palpation in all lobes. Lower extremity skin was nice and warm, good hair distribution, no edema or varicose veins was noted. All peripheral pulses, the femoral, the popliteal, the posterior tibial, and the dorsalis pedis were palpated. Full range of motion was noted in upper and lower extremities. Good muscle strength noted in upper and lower extremities. And good hand grip was noted. Heel to shin test was negative. Patellar reflex was positive. And negative scoliosis screen was noted.